Okay, so my disease is colorectal cancer. Colorectal cancer starts in the large intestines or rectum. It's typically a result of polyps on the inner lining of the colon or rectum. Anybody can get colorectal cancer, men and women. However, men have a higher rate of getting and dying of colorectal cancer. The American Cancer Society estimated 107,320 new cases of colon cancer and approximately 46,950 new cases of rectal cancer. And you can see on the poster the prevalence in cases between men and women. There are several risk factors for colorectal cancer. Some of the non-modifiable risk factors include age, especially age over 50, genetics, and race. Also non-modifiable are going to be personal or family history of polyps, irritable bowel disease, and diabetes mellitus 2. Some modifiable risk factors include obesity, your level of physical activity, an increased consumption of red or processed meats, and a decreased consumption of fruits, vegetables, and whole grains. Risk factors for colorectal cancer are going to be smoking and alcohol consumption. Some signs and symptoms of colorectal cancer are any sudden, irregular, or interruption in your normal bowel patterns, not feeling relief after having a bowel movement. You may experience weakness or fatigue, cramping or abdominal pain, and unintended weight loss. For screening, the United States Preventative Services Task Force and CDC recommend screening begin at age 45 through age 75. And some of the ways that we screen for colorectal cancer are going to be through a colonoscopy, a CT colonography, stool test, a liquid biopsy, and also a sigmoidoscopy. The CDC does require or colorectal cancer is a reportable disease to the CDC, and the Healthy People goals for colorectal cancer are to reduce the number of cases as well as the illness, disability, and deaths caused by the cancer. Some of the prevention and education that we can teach for colorectal cancer is going to be to notify your healthcare provider in the event of any black tarry stools or any blood in the stool, especially bright red blood. You want to notify your provider with any unintended weight loss. We want to teach to make sure that you are doing your preventative screenings, because colorectal cancer can be cured. There are 4 stages of colorectal cancer. They're actually stage 0 through 4, and typically stage 0 would consist of just having a polyp or polyps found, and typically you can go in and have that polyp removed if it's caught early enough, preventing the spread of the cancer and removing the cancer altogether. Also, we want to teach to avoid diets high in red and processed meats, high in fat, and diets low in fiber. And like most other diseases, we want to limit the intake of alcohol and avoid smoking.